As countries across the world went into lockdown, believing it to be the only established method to stop the spread of the coronavirus, Sweden announced it wouldn't impose such restrictions. There are now 14,777 confirmed cases of COVID-19 in Sweden, a country of just over 10 million, with 1,580 deaths, according to Johns Hopkins University. Sweden's softer approach was already an outlier in Europe as governments across the continent continued to take draconian measures to limit exposure to possible carriers of coronavirus. And as the country's fatality rate leaps ahead of its neighbours, its strategy is coming under even more scrutiny. Among Sweden's Nordic neighbours, Denmark closed its borders and shut its schools, as did Norway, while Finland isolated its main urban region. Sweden has called for its citizens to take responsibility and follow social distancing guidelines along with stronger measures such as banning gatherings of more than 50 people and halting visits to retirement homes. Yet, as part of Sweden's herd immunity strategy, Swedes are able to go to restaurants, get a haircut and send their children to school even as the number of confirmed cases and deaths have mounted, above all in capital Stockholm, which accounts for more than half the fatalities. What is herd immunity? The aim is to try and reduce the peak, broaden the peak, not to suppress it completely. Most people would get the virus mildly, and this would build up herd immunity which, in time, would stop the disease's progress, Sir Patrick Vallance, UK's chief scientific advisor, had said last month, as he explained the logic behind the concept of herd immunity. Despite international attention and domestic debate, the Sweden government has maintained its course, taking its cue from its expert authority, the Public Health Agency. "We don't have a choice, we have to close Stockholm right now," Cecilia Soderberg Norrkala, professor of microbial pathogenesis at the Karolinska Institute, told Reuters earlier this month. She is one of around 2,300 academics who signed an open letter to the government at the end of March calling for tougher measures to protect the country's healthcare system. "We must establish control over the situation, we cannot head into a situation where we get complete chaos. No one has tried this route, so why should we test it first in Sweden, without informed consent," she had said.